Module 4, Risks and Expectations After Transplant. Here is an image of the recipient or your surgery. You will be put to sleep using anesthesia and will remain in the operating room for a couple of hours. Most of the time, your kidney will be placed right in your lower belly, and your diseased kidneys will not be removed. In order to place the kidney into your body, an incision will be made in the lower abdomen, and the artery and vein of the new kidney will be attached to arteries and veins in your body. You will wake up in the recovery room where you will be closely monitored by nurses to make sure that you are stable. You will probably be in the hospital for about 5 to 7 days recovering afterwards. Like any surgery, there are potential risks. These include the uncertainty of success. Your transplanted kidney may fail, even though there is a strong likelihood that it will work. There is a risk of anesthesia and surgery. However, the chance of dying due to general anesthesia, especially now with advancements in technology and medications, is only about 1 in every 200,000 patients. Your surgeon will explain other risks with surgery when you meet with him or her later on. There are risks of post-transplant complications and possible hospitalization. There is also the need for frequent follow-up and testing. There's a risk for infection, malignancy, which is just a way of saying tumors or cancer, and cardiovascular disease. These last 3 risks are due to the medications that you will have to take. Since these post-transplant medications must be taken for the rest of your life, you should be aware that these drugs can lead to many side effects. We will combine different anti-rejection medications to reduce the chance of side effects, and over time you will be able to lower your required doses to further reduce these side effects. Right out of the hospital, you will need to be on a very high dose of anti-rejection medications, since the risk of complications is highest for the first 3 months after surgery. Gradually, you can begin to taper off and reduce the doses as your body becomes more used to your kidney. When you have your blood draws during your evaluation before transplant, your doctors will determine what types of medications you will need and how much you will need after transplant. To be as clear as possible, let's review all of the possible side effects, both the small side effects and the big side effects that can arise from taking these medications. Small symptoms include mood swings, upset stomach, tremors, acne, increase in cholesterol and blood vessel plaque, weight gain, and then life-altering effects include skin cancer, muscle and/or bone atrophy, which is just the reduction in size or breakdown of your bones, cataracts, which can be the clouding of your eye's natural lens, and diabetes. There's a 20% chance for you to get diabetes, even if you were non-diabetic before the transplant. As mentioned in the previous slide, the chance for increased cholesterol and blood vessel plaque is what increases your likelihood of getting heart disease, more specifically atherosclerosis. Atherosclerosis is a disease where plaque builds up inside your arteries. Over time, plaque hardens and narrows your arteries. If you don't smoke, remain active, and watch your nutrition, you can lower your risk for atherosclerosis, but you will still have some risk with the anti-rejection medications. However, an important thing to keep in mind is that your risk for heart disease is actually greater on dialysis than it is after you get a transplant. In summary, it's always important to compare the pros and cons of the required immunosuppression medications and their side effects. The survival rate after getting a transplant is very high. 95% of transplant patients in America are still alive 1 year after their operation, and the main transplant statistics are even better. You will have normal kidney function, so you will no longer have to attend dialysis. However, just remember there is the bad and the ugly. Cancer, infection, and heart disease may or may not affect you after transplant. Last but definitely not least, you must be able to visit the transplant clinic often after you get a transplant. For the first month, you will have to visit twice weekly. At month 2, you will visit weekly. After 3 months, you will visit every 2 weeks. And after months 4 through 12, you will visit once a month. After a year, you will visit every 3 months. Getting to Portland is your responsibility, and if you think this will be an issue after surgery, you must let your coordinator know. In the long run, you may be able to substitute some time at the transplant clinic with your local nephrologist. Next step. Complete the survey to assess your understanding, and make sure you also understand the risks associated with transplantation, including surgery risks and medication side effects. Then you can continue to the next module, Financial Facts of Transplant.